Hello, I'm Anupama. Today we are going to talk about the basic concepts in social work, the career opportunities in social work, and a brief history of social work in USA. So let's start with a global definition of social work. Social work is a practice based profession and an academic discipline that promotes social change and development, social cohesion, and the empowerment and liberation of people. Principles of social justice, human rights, collective responsibility, and respect for diversities are central to social work. So, what does the basic definition of social work say? It says that social work is a practice based profession. It is also an academic discipline that promotes social change and development, social cohesion, empowerment, and liberation of people. And the basic principles underlying social work profession is social justice, human rights, collective responsibility. It's a responsibility of a people together and respect for diversities that are central to social work. Diversities is the difference among people externally and internally. Social work is assisting others to bring about healthy change within themselves and their communities. Underpinned by theories of social work, social sciences, humanities, and indigenous knowledge, social work engages people and structures to address life changes and enhance well being. Becoming a professional social worker entails working with people in order to develop their capacity and potential for creative and fulfilling human relationship. So, social work is basically assisting people who are unable to cope up with their life situations to have a more fulfilling life. Not only individuals but groups or communities. So let's now see what are the career opportunities in social work. Social work offers a variety of career opportunities, like in various fields. It offers variety of career opportunities. The first one being the area of child protection. Child protection in the sense for those who like working with children who are abused, neglected, runaways, or abandoned. Social service agencies across the nation have positions in adoptions, foster care, protective services, residential care, as well as services to unmarried parents. These are all children who have some issues in adjustment from like with their families, have issues in their families, or are orphaned. But other than that, social work also supports children who are in who doesn't have much of social issue but are in normal schools, but due to some circumstances face um, some issues in their lives. Social workers also work with children who are in stable home environments. They like a normal environment also. When children face issues, they support these children. They respond to crisis in the classroom and assess and counsel school children who are experiencing stress, acting out, or are being targeted by bullies. Some conduct groups targeted towards prevention. They also conduct trainings, make reference, and serve on interdisciplinary teams. What is meant by interdisciplinary teams? That is, social workers work in school, social workers work along with the teachers, along with the parents, also with the psychologists, also with the psychotherapists, all if necessary, doctors, occupational therapists, or physiotherapists. So it's a team to social work is the helps in the networking, and as a team they work with the issues, work for the issues within the children or around the child's school environment or familiar environment. Social workers also provide support and therapy to children who are experiencing traumas, losses, or extra familial abuse. They work with youth who are experiencing serious problems. Work settings are varied. Some social workers have offices in public, elementary, or secondary schools. They may be stationed at one school or have responsibilities at several schools. Other social workers work for governmental organizations, residential care facilities, adoption agencies, or other social service agencies. Their job duties may take them out into the community. They may, for example, visit the homes of parents or prospective guardians. Sometimes there are times when they need to testify in court also. Now, next is the field of medical social work. Medical social workers practice in general hospitals, public health departments, home health care, hospice, and long-term care facilities. They work with people experiencing social, psychological, and economic problems associated with their illness and are also involved in discharge planning. So from the moment a patient is taken into the hospital till the discharge, the social worker works with the team to help the patient, support the patient, the family members of the patient. They understand the family history, the social situations of the patients, and the starting, the triggering factors in their illnesses, and they remain in the team and work with the team till the discharge planning is done, sometimes even after that. For like when some patients need supportive care at home, they do home visits and support the patient till the patient starts living in integrated into the society and live come into the mainstream. For example, when a mother has just discovered, this is an example, when a mother has discovered that a child has some illness, some severe illness, potentially life-threatening illness, a million thoughts races through her mind. What's going to happen to my daughter? How serious is her illness? How can my family afford the treatment? How will I support the day-to-day services as a caretaker? So, in all these aspects, social worker try to support the patient, her family. Like even in financial aspect, it's not like directly helping the patient with the money, but the social worker helps finding out agencies which sponsor such kids with such illnesses, or agencies which gives loans, or even supports children with these illnesses. There are many agencies and trusts for kids or people who are suffering from life-threatening diseases. There are many non-governmental organizations, NGOs that work for many kind of life-threatening diseases like thalassemia, cancer, or many other kinds of illnesses. So, a worker helps the parents or family to network with such agencies and help the child out from the issues, and also help them in their aftercare, help them find support in their aftercare. In confusing and overwhelming times, it's important for families to have somebody knowledgeable to lean on who can help them manage their emotions and navigate the complex medical system. That's where medical social workers can step in. Mental health. Social workers are members of psychiatric team in mental health centers and hospitals for the mentally ill, emotionally disturbed, and the chemically dependent. Here, the chemically dependent means substance abuse, people with substance abuse, drug abuse, and alcohol addiction. So, such social workers are called psychiatric social workers. They help the families and the patients who have any kind of psychiatric distress. They support the team, they work with the team to help the patient. And then in correctional settings, what are correctional settings? Any people, any child who has an issue with law, or even adults who have an issue with law, social workers support them and help them live a more fulfilling life, give them alternative training, help work with them, and they are mainly social workers are employed in penal and correctional facilities serving both juveniles and adults. probation and parole services, juvenile courts, and delinquency prevention programs to help. How do they help them in a correctional setting? They understand the person in the correctional setting. They find out about their family history, their childhood history, and the main issue, psychological distress, any the reason behind the crime, how he became, what was the triggering force behind his crime, and tries to understand the criminal as a person, and help them, support them to, and help them come into the mainstream of the society by giving them alternative training programs for work related, like vocational training, and help them in to connect with agencies which help support people having these kind of issues. So um, and social workers next have many career related opportunities in many other social service agencies, like old age homes, orphanages, home short stay homes, etc. Many different social service agencies employ social workers to work with victims of spousal abuse, the aged, the homeless, dependent children, the disabled, and families experiencing social and economic problems. So social workers also work in many kind of agencies like this. Now, what are the top points that we saw till now? Social work is practice based, it is an academic discipline, it promotes social change and development, it also promotes social cohesion, it promotes empowerment and liberation of people, and it has various career opportunities in the field of child protection, mental health, correctional, and social services. Now let's move on to the history of social work starting from the United States of America. Actually, in India also we had social work in different forms. There were so many social reformers during the time of our freedom struggle, but social work as a profession, with a scientific approach, came with education, with educational schools, came into being much later. So we'll start off with the history in United States of America. As a profession, social work officially originated in 19th century as a movement primarily experienced within the United States and United Kingdom. After the demise of feudalism, those in poverty were seen as a direct threat to social order. So the government formed the Poor Law and created an organized system to provide care to them. While the Industrial Revolution sparked great leaps in technological and scientific advancements, the great migrations to urban areas throughout the Western world led to increased social problems and, in turn, social activism. During this time, rescue societies were initiated to resolve the problems of poverty, disease, prostitution, mental illness, and other affliction. So, what does this say? And when during the start of industrial revolution, and when there was the demise of feudalism, the agrarian society was had changed into an industrial society, was slowly turning into an industrial society. So there was a lot of migration from the rural areas to urban areas, which caused so many poverty related issues in the urban areas. There were so many areas in cities. The cities started to grow, and there were so many areas in the cities where there were which were like called urban slums, like people who migrated from rural areas who were working in the industries stayed. So in these areas became a place for many social issues which are caused due to poverty, like diseases, prostitution, mental illness, and other afflictions. So a government started a law for the poor people, and there were so many homes for the orphans, or so many places for people who are disintegrated. But these were not like more empathetic ways of supporting the poor. So there needed some support which should be given to these people, understanding them, their background. The initial support given by the government during those times were more mechanized type, which they didn't understand the human emotions, or it was not empathetic to the situation of the human beings involved in this poverty situation. In the late 1800s, a new system emerged as a method for providing aid for social ills. As one of the most influential early professionals in social work, Jane Addams was a founder of US settlement house movement to establish settlement houses in poor urban areas for volunteer middle class social workers to alleviate the poverty of their low income neighbors. Focused on the causes of poverty through research, reform, and residence, early social workers in the movement provided the poor with education, legal, and health services. By 1913, there were 413 settlements spread across 32 states in the nation to improve the lives of the poor. So, from this slide, we basically understand that Jane Addams was the pioneer in social work in United States of America in the 1800s. She started the US settlement house movement. Settlement house is nothing but basically a poor neighborhood, or maybe we call it as a slum, where the people's like industrial workers, low income people stay. There were so many settlement houses, so these social workers or reformers worked in these settlements to understand and identify the issues in the settlements and give support services in medical, psychological care, and other support services. So Jane Addams was the founder. She also trained other people in the field of social work to support the poor neighborhood, poor neighborhoods, people living in the poor settlement houses. So it started in the late 1800s, and by 1913 there were around 413 settlements in across 32 states in the United States to improve the lives of the poor. So while the movements for social reform continued to escalate in the early 20th century and many schools of social work were established, the question of whether social work was a profession lingered. In 1915, Dr. Abraham Flexner famously contended that social work was not a profession because it lacked specific application of theoretical knowledge to solving human issues. As a result, the professionalization of social work began by concentrating on casework and the scientific method, and the American Association of Hospital Social Workers was established in 1918 to boost formal education opportunities in social work. So, as social work was developing, there were many questions, many criticisms regarding the professional base of social work. Many people believe that social work is not a profession. It doesn't have that scientific base. Does social work need to be a profession? So, Dr. Abraham Flexner was one of the main person who criticized the professional base of socialism. He was against making social work a profession. So, like understanding this, many social work professionals started to started to make a professional base for social work, give it a scientific approach, and in 1918, the American Association of Hospital Social Workers was established to boost educational opportunities in social work. So how it can be, social work can be learned professionally with scientific approach, can only be done through formal education. So many social work schools was established, and it was started off by forming by the American Association of Hospital Social Workers in 1918. And next was the formation of National Association of Social Work in 1955. Despite facing competitions with the rising popularity of psychology and psychiatry, there were 10 university programs in social work by 1929 to add a more scientific basis to dealing with patients and challenging behaviors from mental dysfunction. As World War II came to a close, social work saw another great rise in the number of social workers to serve the needs of military veterans returning home from battle. By 1955, the National Association of Social Workers was formed to promote professional development, advance social policies, enhance educational opportunities in the field, and maintain professional standards of practice. So, the National Association of Social Workers was formed in 1955, which was another milestone in the professional approach in social work, making social work a more professional field, a professional area of work. Because there were so many competitions for social work from psychiatry and psychology, because people rather confused with all three disciplines. But basically, psychology and psychiatry are different disciplines which work in different areas in a person's personal or social issues. Social work has a multidimensional approach. Today, social workers continue to lead the way towards social justice by developing private and charitable organizations to serve individuals and communities in need. Now, as one of the most diverse healthcare fields, opportunities in social work continue to grow much faster than the average for all other occupations. So that's for today. That's all for today. Thank you so much. I hope you got a you got an understanding about the basic concepts in social work, career opportunities, and also the history of social work in United States of America. Thank you so much.